What is defensive medicine? Defensive medicine is a phrase that describes situations in which physicians order medical tests, procedures, or consultations of doubtful clinical value in order to protect themselves from malpractice suits. In other words, it's the way physicians collect and document proof that they did everything they could for their patients in case they have to defend their medical decisions in court. Let's look at how defensive medicine happens on a day-to-day basis. Meet Dr. Kolb. Dr. Kolb is on duty at the emergency department of Community Regional Hospital. He meets Lindsay, a patient who is experiencing chest pain. Lindsay is a 45-year-old with high blood pressure and no family history of coronary artery disease, the cause of heart attack. Through his evaluation and experience, Dr. Kolb is confident Lindsay is suffering an atypical chest pain that is not cardiac. But Dr. Kolb is at personal risk if he sends Lindsay home without evidence that supports his diagnosis. He knows that were Lindsay to have a heart attack at any point after leaving, he could be sued. So he admits Lindsay to the hospital for overnight observation. The next morning, he orders a stress test for Lindsay for the sole purpose of getting documented proof that the pain isn't cardiac related. Lindsay finally goes home, and the entire process costs $10,000, most of which was unnecessary. And Dr. Kolb will be the first to tell you that this occurs in his ER almost every day. Now meet Dr. Mullins. The parents of a 1-year-old little boy with a head injury insist that Dr. Mullins makes absolutely sure nothing is wrong. After her examination, Dr. Mullins is confident the child's head injury is minor and the child will experience no complications or risks. In addition, Dr. Mullins is very aware of new research showing that children under the age of 2 who have had CT scans of the head develop measurably lower IQs than children not subjected to radiation. What to do? If she chooses not to subject the child to a CT scan, she knows she can be sued for negligence. If she orders the CT scan, she knows she's exposing a child to unnecessary risks. After explaining her diagnosis and the risks of further testing, the child's parents insist Dr. Mullins be certain, so she orders a CT scan. Why do physicians like Kolb and Mullins practice defensive medicine? Simple. To protect themselves in the event they are sued, they know there is a high likelihood they will be sued at some point in their medical practice. But what about the financial upside of defensive medicine? Unfortunately, many people believe physicians benefit financially when they order more tests, treatments, and consultations. However, this is not reality and couldn't be further from the truth. The facts are only about 6% of physicians' total compensation comes from orders such as prescriptions, imaging, lab tests, admissions, and surgery fees, and most of those orders are not defensive in nature. The vast majority of physicians earn no income from the tests, prescriptions, procedures, and admissions, regardless of why they are ordered. Instead, they are compensated through a combination of fixed payments, such as salary or hourly pay, and variable payments, typically tied to productivity, bonuses, and ownership. Defensive medicine is a serious problem. Imagine a world where doctors could practice efficient medicine because they weren't constantly worried about malpractice lawsuits. Imagine going to the doctor for a routine checkup and not being subjected to a litany of tests of doubtful clinical value. Imagine the possibility of saving hundreds of billions of dollars each year in medical expenses. Patients for Fair Compensation has a solution. It is called a Patients' Compensation System. Learn more at patientsforfaircompensation.org.